our monthly visit from Sandi Sawchuck from the UW School of Veterinary Medicine.
She's ready to take your calls at 270-9933. Welcome back. I've been seeing a lot of you lately, personally.
You have been seeing a lot of me, and I'm just looking at this cold weather that's coming, and I'm thinking, poor Esty. He is having surgery done right now at the vet school. He has a new mass came up on his side, and it felt kind of soft and squishy like a lipoma, but it was acted very differently because it grew quickly. And so with any new mass, we always want to make sure it is. Even if it feels like something benign, check it out. It turned out to be a soft tissue sarcoma. And your little boy is going to have a big shave spot, and he's going to need a jacket for most of the winter, I think.
He's in good hands. But
he is, yeah.
And the reason we're telling this story, the importance of checking your animals up.
Checking them.
Because we did this last Friday, and he's having surgery already today.
Right, right. And the thing is, a month ago he was in to have his ears checked and so on, and that mass wasn't there. And so we keep body maps of every pet that comes in. If we find a new mass, even if it's benign, we still chart it so that we know what it is. And don't just assume it's something because it's soft and squishy. Get it checked out.
Good luck, Esty.
You're doing well. You're holding up.
Team Esty.
Yes.
Team Esty. All right, let's go to the phones. We'll start with Tammy in Merrimack. Hi, Tammy.
Hi.
Hi, what's your question?
I have about a 2-year-old purebred Persian that I recently rescued, and I really know nothing about her background. And she's been itching, like, all over her body and her feet, and she's also doing a little sneezing. But I have taken her to my vet, and she was put on a select protein diet, which is pea and venison. But I was wondering possibly, too, if it could be like a grain allergy.
Grain allergies are actually quite uncommon. When I think of an itchy cat, especially a 2-year-old, the thing that comes to mind, and if it came from a place where maybe it was housed with a lot of other cats, you need to get parasites off the table as well. Don't just assume allergies, but there are a number of mites and things that can make cats quite itchy, and often we will look for them. If we don't see them, we still go ahead and treat. Allergies, yes, definitely for a 2-year-old cat. Environmental allergies are probably much more common than food allergies, but your veterinarian's doing the proper thing, getting your cat on a very limited protein diet, or a hydrolyzed protein diet would be something else we could use for a good 2 months or so to see how well your cat does. The sneezing, probably just part of being a Persian. They've got those pushed-in faces, just like Esty, have a hard time breathing sometimes. And being a Persian, they come from a cattery. They may have been exposed to some upper respiratory viruses, and that may be nothing. But the itching may take a while to get it under control.
All right. Let's go to Lewis in Stoughton. Hi there. What's your question?
Yeah. Hi, Sandy. I have actually, it's kind of a 2-part combined question. I have 2 black Labradors. One is 14, and one just turned 9. My 14-year-old is losing weight, you know, in her old age. The 9-year-old seems to be wanting to eat her food that she doesn't eat.
Okay.
So what we've been doing is, you know, feeding them separately.
Good.
So, you know, that's okay. But then when it comes time to treats, we'd like to give our old dog the treats she's used to, because I figure, you know, she's 14, you know, let her go.
Enjoy them. Right.
The 9-year-old now, I've got her only having raw carrots and raw sweet potatoes, which she likes.
Yeah, and she's probably gaining weight because if she's eating the other dog's food. So you've done the right thing keeping them separate. But don't assume weight loss is just an age-related thing. There could be a medical reason for it, that she may be losing protein through her kidneys. She could have a tumor someplace in her body that's causing her to lose weight. There's a number of different things, and so getting a good physical exam done, getting some blood work done, and hopefully they'll find the cause so that the dog can get her weight back on, and we don't have this issue with leftover food causing the 9-year-old to gain weight.
And just old age doesn't necessarily mean weight loss.
Age is not a disease. No, not necessarily.
Thank you, Sandy.
Thank goodness.
All right, we're going to take a quick break and get some more calls right after this. We are taking calls with UW veterinarian Sandi Sawchuck, and let's go to Donna in Madison. Hi, Donna. Donna, you there?
Yes.
Hi, what's your question?
Hi, Sandy.
Hi.
I have a terrier mix. He's 21 years old.
Oh, my goodness. Wow.
I know. He goes to the groomer at least once or twice a month. Gets his nails done and the whole thing. This dog has the worst odor that I've ever known. And we don't know. We can't find out what is causing this.
Well, there's a few things that come to mind that I think of when I think of an older dog, and definitely a 21-year-old dog is one of those very special older dogs. Dental disease is probably number one. They get periodontal disease, and especially if they're licking their feet or anything like that, they may be spreading bacteria. That is one of the leading causes of just overall dog body odor problems. One of the other causes, though, is just the fact that their skin tends to change and their hair coat changes, and they tend to get a little more seborrheic, and so they start to get that kind of rancid smell. And one of the things that I always recommend for older pets is washing the bedding. You can take your dog to the groomer, but if you're not washing that pet's bedding, they're getting that dog body odor right back on them again. So if you bathe your dog, wash the bedding.
That's good advice.
Keep it under control.
Very good advice. All right, let's go to Maureen in Barneveld. Hi, Maureen. What's your question?
Hi. Sandy, I got a quick question, I guess. We've got a new puppy, which I should have examined. We love her dearly. She's just 11 weeks old, and she's doing real good going out, doing her poopies. And when she sleeps in the kennel all night long, she doesn't wet. I let her go out to go potty. She'll go potty. I give her a treat, commend her again both ways if she does either duty. And she'll turn around then, and even after going outside piddling, within like 5 minutes later,
in the house.
She'll pee,
Oh, couple of things. It sounds like you're right on the right track with housebreaking. You're rewarding the behavior. You're keeping her under control in a crate. She sounds like she's doing really well. And I'm surprised because with this cold weather, people have to have their head examined for getting a puppy this time of the year. But what I get concerned about is she's an 11-week-old female puppy, and they are more prone to developing vaginitis and secondary bladder infections. And it's very possible that she could have something medical going on. So if you haven't taken her in, that would be the first step. Collect a urine sample yourself, but your veterinarian may want to get a sterile sample from her when she's at the clinic. So make sure that you carry her in so she's not on the ground, so we have a full bladder so we can collect a sample and get that looked into first. And then it may just be that we need to get that second trip out 5 minutes after she's gone to the bathroom.
It sounds like she's doing the right thing, though.
She is, yeah, definitely. 11 weeks old, I wouldn't expect them housebroken at this point.
I'm 58, I'm not. Sandy, thanks for being with us today.
Thanks, Sandy. Great to see you. Thanks for your call.
Check into my boy, will you?